Okay, welcome everyone to this special meeting with the Sinn Féin ministerial team here in the 6 counties to discuss the important issue of COVID-19. This is indeed a very worrying time and people are very anxious. And we firstly want to extend our condolences to all of those people who have died as a result of the COVID-19 virus. I'm Deirdre Hargey and I'm the Minister for Communities in the 6 County Executive, and I'm also an MLA in South Belfast. And I'm delighted to be joined here tonight by the Joint Head of Government, Michelle O'Neill, our Finance Minister, Conor Murphy, our Junior Minister Declan Kearney. And I know people have many questions here tonight on this important issue and the concerns that you have. So I'm going to hand over firstly to Michelle O'Neill, MLA, who's just going to outline where we are at the moment and the next steps.
Thanks very much, Deirdre, and thank you to everybody who have joined us this evening. We are obviously living in very strange times and we're in the middle of an unprecedented crisis. None of us have ever been through this before, so it's new to everybody, and people are afraid, people are concerned, and people have many, many questions. What we want to do tonight is to speak directly to you, to be able to try and answer some of those questions which you have. And if this works out, then we can continue to do this throughout this crisis. This isn't just a health crisis. This is a crisis that's affecting society right across the board. And we're all being asked to do things now that we never would have dreamed of over the course of the last weeks or months or ever in our lifetime. And the impact is immediate all around us. We feel it because we are people and our families feel it, and we know the measures which we're all having to take. But ultimately, this is all about saving lives. How do we save the most people's lives throughout this pandemic? We can't stop it, but we can certainly try to reduce the loss of life. Our response is evolving, and at the core of the response to fighting back against COVID-19 has to be testing. The World Health Organization has said that we must be testing more, testing and isolating and tracing. So that has to be at the core of the fight back. Also protection for our healthcare workers and all those workers actually out in the front line doing their very best for us. They must be protected in this period. You've sent us in over the course of the last couple of days a deluge of questions, and we're going to try and work our way through all of them. Tonight we've brought the entire Sinn Féin government team to the meeting, and we want to tell you that we're working round the clock to develop our response to what is an unimaginable crisis. But I believe that our response is making a difference. We're acting to save lives. Everybody has a part to play, and we all have to play our part in the fight back against COVID-19. We've been trying to act with the utmost speed and urgency, and many initiatives have already been put in place, and there are many more things to be done. We all have to act responsibly at this time, and the advice can sound really simple, but it is crucially important that we act responsibly, that we do not gather together, that we stay apart to stop the spread of the virus, that we wash our hands to kill the virus. Those are the things that are actually going to really make a difference. Before I bring in the wider team, I wanted to make just 3 points to you this evening. 3 important points around the Sinn Féin's response to the crisis. Firstly, we're in a 5-party executive, so without agreement, we can't always do the things that we would want to do. And we saw that with issues such as school closures, where that took too long to come about. We also have the issue of manufacturing businesses, construction businesses, some people still working. And in our view, that shouldn't be the case. There should be support to allow those people to shut down. We've also tried to provide the maximum information. We've also tried to provide the maximum information to bring about all the questions, to give you answers to the questions, and we'll continue to do that. But we are in the unknown territory. We're in ground that we've never been on before. And thirdly, the thing I would say to you is that Sinn Féin are determined to bring the best possible leadership throughout this pandemic. We will do everything to protect you, to save lives, protect and support our frontline healthcare workers. We'll stand with you every day because we need the healthcare workers more than ever now. We must do everything we can to protect them. We are in uncertain times. We're in uncharted territory. We have many dark days ahead of us. 67 people across this island have already lost their lives in the battle against COVID-19. Our thoughts and our prayers are with those families who have lost their loved ones. We're going to get through this. We're going to get through it and come out the other end. But there is going to be dark days ahead. We will continue to work tirelessly on your behalf to do everything that we can to support our communities at this very difficult time. We're in this together. None of us are immune. So we need to work together, and the Sinn Féin team will continue to provide leadership to make sure that's the case. Thank you very much, everybody, and we really look forward to engaging with you tonight.
Thanks very much. And I'm just going to start now. There's many questions, as Michelle said, that have come in, and I'm going to try and group some of those together just so that we can answer as many as possible. And the first ones are from Sean McElhenney, who says that there's a national emergency, and this has thrown up many financial issues for workers and their families. And Sean asks about what we can do here in the North and more widely in terms of involving civic society, and in particular the labour movement, and managing our way through the situation. And Jared Rice from Belfast also talks about the amazing role of community activists who are responding to this national emergency on the ground. And he asks how best they can assist with government and statutory agencies in helping their communities in the time ahead. And I'm going to ask Declan Kearney to answer those.
Deirdre agus séwer maha galéir Hargey agus ta fáilse céad roh is Jack's and Coralian and Ocht. And thanks to Jared and to Sean for those questions. They are linked. The common denominator running through all of this is that we are faced in, as Michelle said, to a national health emergency arising from this very vicious, aggressive global pandemic. And we will not be able to withstand the impacts of this health emergency and all of the social and community and economic repercussions that will flow from that unless we have a total society response. So to begin with, I want to acknowledge all of the powerful work, the spontaneous work that has just grown up over the course of the last 3 to 4 weeks in direct response to COVID-19 right across our society. That's in the north and in the south. And people are absolutely powerful. I mean, the effort, the resolve, the determination, the solidarity being shown is just phenomenal. There's an Irish phrase that says, "Akela awaris nadini." We live in each other's shadow. Well, we indeed are living in one another's shadow in the context of COVID-19. And we do need much more of that community activism that will act as the resilience that central government will require to ensure that the necessary measures are put in place to maximise public health, to save lives, and to ensure that we secure our public services through this very, very trying period. So I would appeal to people like Jared and thousands of others right across the island of Ireland to keep on doing what you're doing. But we do need increased coordination in relation to those efforts. So last Thursday, Deirdre, myself, convened a conference call with a number of our officials to engage directly with the regional leaderships of Cumann Class Gael, the Irish Football Association, and also Ulster Rugby, along with representatives from local government, to discuss how, in fact, we can best harness all of the human resource capacity and potential that, in particular, the largest sporting organisations in the North can mobilise to best effect. There is a civil contingency structure in place at the centre of government, and what we're trying to do is to build a structure which would take its lead from civil contingencies, build on the existence of our 11 council structures, but then introduce the strength and the organisational infrastructure of the 3 main sporting organisations to provide additional direction and backbone and focus for all of that community work that has grown up spontaneously across the ground. In terms of Sean's point, again, it's a total society response. We do need to see all of the social partners strategically engaged, along with central government, in how we fight back against COVID-19. So we do need social dialogue. We have social dialogue structures in the 26 counties. In the course of this week, we will see a forum established, which has been mentioned in the news announcements of last night by the executive. That forum will bring together all of the employer organisations, business organisations, the labour movement in the North, along with the Labour Relations Agency, who will convene and chair that body. I'll be participating in that structure on behalf of the executive myself, and we would envisage that that forum will assist the executive in dealing with what is a very fluid situation in relation to employment issues, to ensure that workers are kept safe, that we ensure that employers are applying very rigid and clearly defined social and physical distancing measures, that if someone has to go to work, that they're safe at work. It will also provide an opportunity for the voice of workers across the North to be heard directly by central government in relation to how we move forward. And to finish on this, Deirdre, we have massive economic challenges arising from all of this. Our economy will be negatively impacted. Workers are the backbone of the economy. We will need our workers and the labour movement to help us rebuild the economy in the aftermath of COVID-19. And for that reason, it's so important that our community is mobilised productively and positively, and the labour movement and other social partners are also productively and strategically mobilised at this time.
That's Declan, thanks very much. And that rolls on into another series of questions, and there's been a lot of interest around this, and I'm just going to ask in terms of Gary Dolan, Round and Happy, and also Ciara Doran, who all ask about the entitlement for cross-border workers and what is available to them. And I'm going to ask Finance Minister Conor Murphy to come in.
Okay, thanks, Deirdre. Well, there are two schemes available from the South. One is the pandemic unemployment payment. And unfortunately, thus far, that has not been made available to people who live outside of the 26 counties. And so quite a lot of workers from my own area here on the border and right around the border areas who live in the north and work in the south have been unable to avail of this particular payment because it applies to residents only in the south. Now, we have raised that issue with the Dublin government. I know our TDs, Pearse Doherty, John Brady, have been raising this directly with ministers in the Dáil, and we will be writing ourselves to those ministers to try and affect a change to this scheme to ensure that people are able to access this payment. There's also an employee retention scheme similar to the one that's here in the north that came from Britain, and it is done through the employers, so there should not be any residency issue with that. So if the employers avail of the employee retention scheme and pay out up to 70% of the wages up to a certain level, then those employees, regardless of where they live on the island, should be able to avail of that. But the directly apportioned scheme from the government has confined itself to 26 counties. I think that should change. I think it's unfair on people, particularly those in the hospitality industry who were laid off very quickly at the start of this pandemic, that those people should be able to access that money. And we will continue to press, both from the executive side ourselves and also from our colleagues in the Dáil, Pearse and John and other TDs, will be pressing this issue with Dublin ministers.
Thanks very much, Conor. And another issue around workers' questions coming in from Colin McKernan, and obviously it's the important issue of self-employed taxi drivers. And I know it is something that taxi drivers have been very vocal on, where their work has dried up and they've had to come out of work. Obviously, this is an issue that we're acutely aware of. We know that the British government have announced their plans around the self-employed. And obviously, whilst we welcome the steps that have been taken, it doesn't go far enough. This has been raised directly by both Conor and also Michelle with the British government in recent days. If there are taxi drivers out there, I mean, we're keen to engage, and I know Nicola Mallon, the Infrastructure Minister, is looking to see what schemes can be put in place and how the executive could be involved in supporting those schemes. And I think there's also the social security system, so that's safety net for people as well. There's the discretionary support scheme, which I launched in recent days. And so far that has already paid out over £307,000 to over 1,300 individuals to support them. And indeed the other statutory sick pay and also universal credit. So I would ask many of the taxi drivers to look at those options that are available, but we will continue to raise this important issue with the British government for them to deliver in the time ahead. I'm now going to move on to another issue from Lisa McKenna from Armagh, and she's seeking clarity on support outlined for the self-employed and details of how this is going to apply. And again, I'm going to ask Finance Minister Conor Murphy.
Yeah, well, there were two schemes come out of Britain, Deirdre. One was that employee retention scheme, which is paid directly through the employers themselves, and those firms which have had to close down as a consequence of the coronavirus and the impact it's having on the economy, and the need to isolate and separate and stay at home for workers, and those firms which can't afford proper social isolation for workers and social distancing then have been obliged to close down. And essential workers and essential services really are the only people who should be open at this time. And a lot of those people have been able to apply to the job retention scheme, which has obviously allowed them to pay up to 80% of the wages of their employees. We pressed after that with the British Treasury, and I'm in a weekly contact with the British Treasury as the Finance Minister, to open up a scheme which would address the self-employed. And they brought forward a scheme last week. And while it is, I think, welcome, there's no doubt it will be done directly through HMRC, but it will, again, a portion, a part of what people were earning as self-employed over the last number of years to them. The difficulty for us is that this doesn't kick in until June. And I spoke on Friday to the Chief Secretary of the Treasury and pointed out that difficulty for him and said people should be able to access it much more quickly because the difficulty is, in particularly those self-employed micro businesses, is keeping themselves afloat essentially until June. It's a long time away for people who are struggling without business to generate some income for them. This is done directly to HMRC, so they will contact people who are entitled to it, so people should await that contact from HMRC. But certainly what we want to see, and we'll continue to press the Treasury this, we want to see payments made much earlier than June so that a lot of our micro businesses in particular can stay alive, can be able to return to full productivity then when this pandemic lifts and we're able to get back to work again.
Thanks very much, Conor. And our next question, and I've grouped a couple of these together because obviously this there's been a lot of questions around these areas, and it's about our frontline NHS workers and those working within the health and social care field. And there are questions in from Mr. R. Kane, Catherine Craven, Mary Louise, all asking about the important issue of PPE, testing for NHS workers and healthcare professionals, and also the use and the need for more ventilators. And I'm going to ask Declan to cover this.
Deirdre, and again, thanks to all of those who contributed to that question. We have a lack of personal protective equipment. We have a lack of ventilators. All of that material is urgently required to assist us in the fight back against COVID-19. We cannot have our frontline health and social care staff taking forward that priority unless they are properly protected. So we need to ensure that the PPE is there for our doctors, our nurses, our clinicians, importantly for our domiciliary care workers who are moving between homes, who are going out there, who are engaging directly with our elderly and looking after those who are most vulnerable and isolated within our community. We also need to ensure that the ventilators are there within the hospitals because this health emergency is going to escalate, and the reality is we are going to see very many more cases of citizens who are coming down with this illness, and sadly we will see more deaths as a direct result. The World Health Organization is the guiding light, the North Star, which has advised and directed Sinn Féin's approach towards the issue of testing. We must test, and test again. Testing is the only way that we can ensure that we locate the clusters of where this disease is concentrated, that allows us to ensure that the sick are separated from the healthy, and that we take the necessary measures then to ensure that people are kept safe and healthy, and that those who are ill are encouraged and helped to get better again. And the equipment is essential to assist us in doing all of that. But Sinn Féin has been very clear from the very outset, we need expansive, massive levels of testing right across the north, matching in the north what is beginning to happen in the 26 counties. We are arguing that we need to move into the range and beyond of 2,000 tests a day to ensure that we get on top of the spread of COVID-19 across the 6 counties. And we're very, very clear and determined that that must be delivered on. Conor has been working very hard through his department to ensure that the supply lines are opened up, These are being pursued as we speak to ensure that the necessary levels of PPE, ventilators and other important emergency equipment are provided. He already has a joint order in China with the Irish government to ensure that there is an importation of PPE delivered to the north. Michelle, I know, has been in contact with Antanestia today. There is a need for us to approach COVID-19 on an island-wide basis. We need to have common strategies between our power-sharing government in the north and the approach that is being taken by the Dublin government in the 26 counties. It is essential that we are working together on the island because this disease is affecting all of us on the island and it respects no borders and no divisions. So an island-wide fight back is what we need. And in that respect, I know that Michelle has been in discussions with the Irish government in relation to the importance of a memorandum of understanding being established, which would codify how, in fact, we can develop maximum levels of cooperation on healthcare strategies, but also what is required to ensure that common transport networks, common supply chains are kept open and that they are not disrupted as a result of the continued aggressive impact of COVID-19 across the island of Ireland.
Deirdre, could I just come in there as well? Yeah. So I've spent the last couple of weeks speaking to healthcare workers who are on the front line, whether that be in a hospital setting, in a community setting, the domiciliary care workers, and they are frightened. They are frightened because they do not have access to PPE, protection for themselves to do the job which they do so brilliantly. And that needs to be resolved, and it needs to be resolved as an emergency, because if we're expecting those people to work really hard to care for our loved ones at this time, they have the most contact with people who are sick and unwell in their homes and in hospitals, so they need support to be able to do their job. I actually have met nurses yesterday who went out and spent £800 buying their own personal protection equipment. That is not good enough. That is not government supporting healthcare workers to do what they do so brilliantly. So that needs to change. We will speak with the Health Minister. We'll continue to make sure that we bring in every bit of PPE that we can get our hands on, because that's what we need to do. We need to support the healthcare workers to do what they do.
Thanks very much. And I'm now going to move on to the next question, which is from Maureen Gill. And Maureen is asking about those with disabilities and those in receipt of disability benefits in terms of support that they can receive for increased costs with having to stay at home and self-isolate, and also what they can do around charges from the banks. And I suppose I'm going to answer this, Maureen, just as the Minister responsible. Obviously, I have taken steps around disability benefits and suspending face-to-face assessments and ensuring that those with disabilities and who are having to self-isolate, that you're not forced to come out to an office and you will not be punished for doing the right thing. We obviously also have to protect our staff that are working within those buildings and defending frontline services. I think the other thing as well, that if you are in crisis and you are seeing an increased cost as a result of self-isolating, I have brought in new measures onto the discretionary support system where you can apply for a grant to cover those additional housing costs at this time. And it's really for people who are struggling and finding themselves in financial crisis. So I would encourage you, Maureen, just to have a look online. You can apply for it online and also by using the telephone. And just to add on that, I know Keith Archibald, our local Sinn Féin MLA, has written and contacted a number of the banks here in the north, asking for those additional fees and charges to be waived. So we'll continue to update members of the public as we're moving forward on this issue. I'm going to move on then to another question, which is from Jerry Harvey in Belfast. And he just says that he appreciates that we are some distance from the COVID-19 finish line and that it's only right and first that we manage the here and now. However, he does ask, in terms of Sinn Féin working as a party, but also alongside the executive, what plan is there for an economic contingency plan that will surely follow on from this emerging issue and public health priority? He realises that there's many a price to pay for recent legislation around grants, mortgage holidays, and he wouldn't like to think that either Westminster or Stormont would use the crisis to cut back on any or all future public spending. So I'm going to ask Michelle to come in on this important issue.
Thanks, Deirdre. I think that whenever you reflect on our public services and the huge strain that they're under now, but they have been under strain for some time, and they've been under strain because of Tory cuts, because of the austerity policy of the Tory government. And for 10 years, they have stripped our public services of much needed money and resources to be able to support the public service to do the brilliant work that they do. And then we find ourselves here today in the midst of an unprecedented crisis where we need all those frontline workers more than we ever did before. And it really puts a premium and a value on the work that's done across the health service. It's incredible. And we find ourselves now in this crisis needing the frontline healthcare workers. We need the lowest paid people in society, actually, right now. That's the people that are actually getting us through this. People who are out there in the bin collection, the people that are working in our shops, people that are out in domiciliary care workers. The domiciliary care workers are in the lowest paid category out there, and they are absolutely first class, and the work they're doing is first class. And it's those people that are actually getting us through. For now, the priority has to be all about saving lives. Everything has to be about how do we save lives. And then when we do come out the other side of this, and we will come out the other side of it, we have to start to build our society. And I hope that everybody comes back to that conversation in a different mind frame, in a different state of mind, because people will have had appreciation of actually the work that all those people out there across those sectors, the work that they're doing for us, the cleaners, everybody that's working so hard for us. We need to support them and value them. And if we're going to build a society, a better society, a just society, then we must make sure that we put them front and centre and we do everything to support them and build them. But our priority for now is all about saving lives. How can we save lives and how can we work together to get to the other side where we have an economy to build?
Okay, thanks very much for that, Michelle. Folks, that's the questions that we have coming in for now. It really is, this is unprecedented times, as Michelle said, and obviously we are working as Sinn Féin ministers within the executive and will continue to work with other executive colleagues in the time ahead. But obviously our priority as a party is to ensure that we do the right thing, that we do protect the most vulnerable and that we save lives. So this is the first in terms of that we have tried this public forum of engaging, and obviously if it works, Michelle as last Octoron and also ourselves as a ministerial team are keen to see this going. And there are other issues that are coming in, and I suppose so we're I suppose encouraged to continue to engage this if you think that it's a good forum at this time. There is an issue obviously that is coming up, and I'm going to ask either Michelle or Conor if anybody wants to make comment. It is the issue obviously of vulnerable people out in the community, particularly around homelessness and those who find themselves in a crisis. And it's just really in terms of what role the executive can play across in a leadership sense to address and alleviate some of the problems that they have.
Well, Deirdre, as Michelle has said in her answer previously, we are suffering from the ongoing impact of 8 or 9 years of austerity. And that has meant all of our public services have been robbed of vital support, and the ability that they have then to respond to the most vulnerable people in society and people in crisis, as you say, homeless people, has been undermined over a number of years. We will be making a budget statement on Tuesday in the Assembly, and what we're trying to do is to get as best resources as we possibly can with the limited finances available to us into the areas that need the most. We obviously have additional spend in relation to this particular crisis, which we have been spending in relation to supporting health, but also in supporting the economy through grants, through business grants, through alleviation of rates burden, but through the budget itself, which we will be producing on Tuesday. We want to try and get support across all public services, try and restore some level of spending, recognising that we're a long way off what we need. And that's why we pursued money as part of the New Decade, New Approach agreement, money which is yet to come to us from the British government. But what limited resources we have, we'll be trying to target those most in need in society. We'll be basing this on objective need and trying to ensure that funding and support goes to the vulnerable people and those who provide services to support them.
Yeah, and just to add on that, I suppose, Conor, I mean, we have launched a contingency plan around those who find themselves homeless. We have increased the beds available by over 200 beds, and obviously that will include also refugee and asylum seekers, so those who have no recourse to public funds. We're obviously working with homeless shelters, with crisis centres around making sure that we can cater for them, and we're looking to increase the budget around the Supporting People programme. Conor's order around PPE equipment will also include those working on the front line, dealing with people who find themselves homeless or in crisis. So we'll continue to do all that we can to address the concerns of those most in need, and particularly those who don't have a roof over their heads, to ensure that we're delivering on their needs. I suppose I just want to ask, in terms of looking at this from an all-island point of view, Michelle, just in terms of what engagement has been happening with the Irish government over the last few weeks and what that's likely to look like in the time ahead.
Okay, thanks. And can I just put on record that I am so proud of our executive team, our whole team, and the response and the way you've been able to work our way through what is such a difficult time right now. We've been taking decisions at such a fast speed. Things that normally take us weeks and months to do, we're turning them around within hours and days. And I'm really, really proud of the work that yourself, Deirdre, you've done in the Department of Communities, supporting the most vulnerable. I'm really, really proud of the work that the whole team has done to put people first. Because our only priority here and now is about saving lives. It's about doing everything we can to support people. And we'll continue to do that. All the decisions that we're taking, and our benchmarks for all our decisions are that we know how everybody feels, because we have families. We are also concerned. My mother's self-isolating. We know that, and that's really hard on families. It's really, really difficult right now. So we just want the people to know that we're on your side, that we are working tirelessly. We know that there's still some things we don't have answers for, but we're trying our very, very best to get answers to those things. In terms of your question around the all-island approach, it's, the disease doesn't stop at the border. there's no barriers here. There needs to be an all-island consistent approach if we're going to get through this. I think that there was obviously over the course of the recent weeks, there's been differences approached in one part of the island, and that hasn't been helpful. It actually has added to the confusion out there, because people can't understand, for example, why schools were closed in the 26 counties but were still opened in the north. That logic doesn't prevail for people, and obviously that's the case. So as Declan has mentioned, we are working very closely to bring about an all-island approach, and we hope that over the course of the next couple of days there will be an agreement signed between the Executive and the Assembly and the Dáil to make sure that we have that all-island joined-up approach. Clearly, in the 26 counties, for example, there is a much more emphasis on testing, and we do not have that here in the north. The approach in the north isn't good enough. We aren't doing enough testing. We aren't following the World Health Organization's advice in the way in which we should, and that isn't good enough. But our team will continue to make the case and fight for increased testing. We've been told that it's going to be ramped up. We need to see that even more, and it needs to happen at speed. So I think that the all-island approach, Deirdre, is absolutely necessary. We're in for a rough ride for the next number of months. People are going to lose their lives. Families are going to be left devastated. Life as we know it is changing. The normal things that you take for granted, how when someone passes, how we would have a wake and a funeral, all those things are different. So I think we need to mind each other. We need to mind each other's mental health. I think we need to look out for each other, look out for society. People have been absolutely outstanding. Declan talked earlier about the community voluntary sector, the GAA. The community at large are just so good. Everybody wants to do something because everybody wants to play their part. And we're going to need all of that energy and all of that effort. And we're going to need to just support each other through what is going to be a very difficult time.
Thanks very much, Michelle. And I suppose another issue that has come up, and again, going back to the issue of workers, is obviously you've touched on the need for testing, the need for PPE equipment, and for people to do the right thing. There are a lot of workers that are concerned that they're still being asked to go into work. They're concerned in terms of their companies continuing to open. And it's just really what clarity or advice can you give those, and also speaking out to employers as we start to move into the peak of this virus?
Well, I think we need to be very clear and say to people that anyone who can work from home must work from home. And any employers must facilitate that where it's possible. Anybody who has to go to work, so we do need our essential services right now. We do need people working in our shops and making sure our food supplies and medicine supplies are still kept going. For those people that need to go to work, their employers must put in every possible measure to protect their workforce. And I think that's really, really important. I have heard numerous reports of unscrupulous employers forcing their workers to work whenever it is possible for them to work from home. and perhaps not putting in the right protections, that's not good enough, and we'll call it out every time that we see it. There is now a number of enforcement actions that have been agreed by the executive, so action can be taken where employers aren't doing the right thing by their employer. I would say that the vast majority of people actually are doing the right thing, but there are obviously some people that are still not doing that. We find ourselves in the north where there is a bit of a confusing picture, again, because the supports that have been announced for both employers to be able to give 80% of their wages to their workforce. That's important and significant. We also now have seen measures for the self-employed, but there are still categories of people that are left out of that. And then it's very difficult for people to be able to make the right decisions. So we accept that it is a confusing picture, perhaps for some people who work in construction or who work in manufacturing. But the rule of thumb is this, that if you don't need to be at work, you shouldn't be at work. Your employer shouldn't be asking you to come to work. Everybody needs to play their part here if we're going to be successful.
Okay, thanks very much, Michelle. Declan, sorry, you were looking in terms of the workers' rights issue.
Well, I would completely endorse everything that Michelle has said. Unscrupulous working practices will not be tolerated by Sinn Féin. We will ensure that the new regulations will be enforced to ensure that no unscrupulous employer, and they are a minority, and I think that's very important to say, but that minority of unscrupulous employers will not be given the opportunity to exploit this national health emergency in order to profiteer on the backs of workers. But my last point, Deirdre, is to say this: our biggest asset are our people. Community solidarity cannot have a price tag attached to it. And if we stick together, we will come through this together. Of that, I am absolutely convinced. And we will come out through the other side of this as a stronger people, as a direct result. Everything has changed. There is now no longer a convention that guides how we will go forward. Everything has changed completely. So there's an opportunity for us all now to go forward strongly, collectively, with community solidarity, to work out how on the other side of this we create a much more caring society. We all, as Michelle said, have family and friends who are isolating. We also have friends who are very, very sick and ill at this particular point in time. And sadly, there are so many families who have lost loved ones as a result of COVID-19. And we will not come through this unless we mobilise together, unless we show solidarity together, unless we bind together and look after each other and show compassion and care for each other. So many people have stepped up to the plate and done so much already. Well, what I would say is, in the time ahead, we're going to need a lot more of that type of solidarity and contribution from society. So don't wait to be asked. Step forward, come forward, work together. In unity there is strength. We will come through this together if we stick together. Let's do everything that we can to look after each other in these terrible times, and we'll be stronger as a result.
And Conor, just your kind of closing remarks and views and the next steps.
Well, I think that we also have a responsibility to provide leadership, and that's what we've been trying to do individually as ministers within our own departments, but collectively as an executive. People do want certainty on things. Some measures have been brought forward from Britain, which are welcome, but have left confusion in their wake, and we've been trying to resolve those issues as we move forward and localise them so they apply properly here. But we also have to give leadership to the community. There are people are fearful of what lies ahead. They need some certainty. They need certainty that people at political level and at leadership in terms of the public services are working for the best interests of the community, and that's certainly what we're doing. And certainly what the view, I think, collectively across the executive is to try and work as best as we collectively can to try and help and protect people. The priority will be the health of the community, and also then to try and sustain ourselves, because people need to put food on the table, they need to have certainty in their own homes, and we need to be able to pick up the pieces on the other side of this. And there will be another side to this. There will be a day when we're coming out of this, and we need society to be able to get back to productivity again, and people to be well again, and move forward. So we collectively are trying to provide that leadership. There are times that is uncertain for us as well. We all have our own family worries too, but we have a job to do, and we intend to do that in the time ahead to the very best of our ability.
And Michelle, just to kind of conclude in the end, obviously we are leading into an unprecedented period in the weeks ahead as this virus starts to pick up. And as Conor touched on, we will come out at this at the other end. So it's just really obviously as Lassa Octron of Sinn Féin and also as joint head of government here in the 6 counties. What are your words as we move forward during this period?
The first thing I would say is that it's people first. We will put people first and people's health, people's life, people's safety first. We're all about trying to save lives. We will try to communicate everything that we're doing with the public as best we can as we get through this unprecedented crisis. There isn't any rule book for this. No one has been through this before. None of us are immune to this. But we, as political leaders, will work our way through this in the interests of the people that we represent. This has to be all about people. It has to be about saving lives. That will be our rule of thumb as we work our way through this. The final thing I would want to say tonight is to all those people who are working on our behalf on the front line, whether in our hospitals, we're in our communities as community nurses, domiciliary care workers, cleaners, ambulance drivers, the bin men, the people who work in our shops, everybody, we applaud you. You are absolutely shining so brightly through this dark day, and we can't say enough. And on the other side of this, when we build a new society, we need to make sure that you are supported, and you are supported in the way in which you should be, because at this time of crisis, those are the people that we're relying on. Those are the people that are actually going to get us through this. So on behalf of the Sinn Féin executive team, thank you so much for everything that you do for our people, and we will continue to fight for you in this period also.
Thank you, Michelle, Declan and Conor. And I suppose just to finish to the public, you who have tuned in, who have engaged with our team, I want to just take this opportunity to say thank you. And as we said, we're committed to doing more engagements and public meetings like this so that we can listen to the people on the ground, to hear their views, their concerns, but also their aspirations and hopes. So if you want to engage with us after this on Twitter or on Facebook, in terms of future meetings and what they would look like. But for tonight, stay safe, stay at home, and Gormila Mayogaf.